I do some advocacy work on behalf of patients, specifically, as you know, around prior authorization, and what we focus on is getting new therapies to market and getting physician societies involved and all of those typical types of things. Since you're the one who would be receiving this, let me ask you, so when we compose letters on behalf of doctors or patients because they don't know what to write, and they're nervous, like, oh, if I'm going to write my congressman, I don't know what to say. And so if we were to help them with a template to give them an idea, or physicians to give an idea, the reason I typically don't do that is because I don't want that template to fly around and then you get like 500 of the exact same thing. And I would imagine you would discount that after a while.
You might.
Yeah, okay. I hear you. We're on the same page with that. It really needs to be individual letters, emails, phone calls from not outside money, as you said. I imagine, as it would be for me, I appreciate that one-on-one relationship as opposed to I'm working with a PAC who's representing a bunch of people and they're trying to get advocacy. And I get it. That's important. That's the way you move things. But I imagine it really is that personal story from an individual. And then as you hear different individual stories, not the same story, that tends to resonate more, or no?
Yes. And what I encourage people to do, the congressional schedule is published. I mean, it's public information.
Mm-hmm.
So for example, that your member of Congress is going to be home for a week or two around Memorial Day,
mm-hmm.
around 4th of July, the whole month of August.
Mm-hmm.
It varies in the fall of the year, whether it's an election year or not, but there are identifiable times when your member of Congress is going to be in the district office. I mean, it's great to get to do a fly-in and get a group of the pulmonologists or the family physicians come in to your office, and you've got 30 men and women in white coats saying, we want you to do this. That's powerful.
Mm-hmm.
But what's also powerful is to come into the district office with perhaps one or two physicians and 3 patients.
Mm-hmm.
And have the patients explain why this is important, why, you're hearing a lot about healthcare right now because the Democrats have decided that healthcare is their golden ticket to win the midterm election. Not sure they're on the right track, but nevertheless, you're going to hear a lot about it because that's the message they're pushing right now. But to get that on a one-on-one with a doctor who knows the technical aspects of the issue, but then a couple of patients are probably just as important, if not more important, than the physician who's going to be there articulating what the problem is and how to fix it. And it's also, I would underscore that, how to fix it. Don't just come in with complaints. Come in with, this is what we've encountered. We think it's bad. This is one idea where you might fix it. Not the only idea, but it's one idea how you might fix it. So that is helpful also because, member of Congress is busy. And here's, give you a pro tip. The congressional staff is someone you want to get to know, particularly in healthcare, but also in energy or veterans issues or things that would affect the Committee on Judiciary. Get to know the staff that's the subject matter expert in that area, in your member of Congress or your senator's office. Don't forget, you have 2 senators, and you'll hear from them every 6 years or so. So they can be met with as well.
I think about it. It's almost like sales in a sense, right? If I have an issue that I want you to know about, well, what's the reason I want you to know about it?